Good afternoon. Welcome, everyone. Thank you for joining us today. Hi, good afternoon. My name's Allison Paxson, and I am a Policy and Program Manager with Healthy Schools Campaign. I am so glad that you all could join us for today's presentations and panel on protecting and strengthening Medicaid in schools. There really is no doubt that this is a crucial time to advocate for Medicaid and its role in advancing student health, and I'm really grateful we have this opportunity to share and learn from each other about effective advocacy strategies to keep Medicaid strong. And so, in case you're not familiar with Healthy Schools Campaign or HSC, we work at the intersection of education, health, equity, and sustainability. Ensuring that all students have access to comprehensive, sustainable school health services is core to our work, and also to building positive, thriving school environments. We are committed to protecting Medicaid funding and the vital role it plays in supporting children's health and well-being. And if we move to the next slide, I just want to say that today we're also really grateful to be hosting this webinar alongside Community Catalyst, our amazing partners who work to create a health system rooted in race equity and health justice in a society where health is a right for all. We really appreciate their partnership and this work. And so before I review today's agenda, I just want to mention a few housekeeping items. First, this webinar is being recorded. We'll be sure to send it out with the slides and resources after the webinar. And then second, both the chat and Q&A features are enabled also for this webinar. So if you'd like to ask a question, introduce yourself, or make a comment, we welcome you to do so at any time. We'll do our best to answer all questions in real time today, but if we don't get to yours, we'll follow up with you after the webinar. And so for today's agenda, I'm going to first provide a high-level overview of Medicaid's role in schools. From there, Orla Kennedy with Community Catalyst will walk through what is at stake right now for Medicaid. Then we'll turn to state advocacy perspectives. We'll hear from 3 advocates from 3 states, Missouri, Utah, and Ohio, about the work they're doing to protect Medicaid and lessons learned from their advocacy. And then finally, we'll be sharing some resources and quick actions you can take right now to tell Congress to protect Medicaid so kids can continue to get the care and support they need to thrive. And so first, I'd like to share some brief context on why school health services are important and how the Medicaid program plays a key role in supporting schools to provide them. Significant research shows that school health services improve student health outcomes. About 20% of children have a physical or mental health condition such as asthma, diabetes, anxiety, or other physical or developmental disability that can affect their ability to succeed in the classroom. For children living in low-income households with special healthcare needs, approximately 85% do not receive the necessary care they need, primarily due to financial barriers and limited access. Meeting children where they are each day, providing access to health services in schools, can reduce these barriers and improve health outcomes. We also know that student health services improve educational outcomes. Healthy students are better learners. Children with unmet physical, mental, and behavioral health needs cannot learn to their fullest potential. Access to health services in school is proven to reduce student absences, boost literacy and math skills, and improve graduation rates. Even when just one student, experiences health-related barriers to full classroom participation, it can negatively impact the learning environment for all students. And so overall, the research consistently demonstrates the essential role of quality school health services in promoting the success of all students in the classroom and beyond. And so for the next slide, what is Medicaid? Medicaid is a health insurance program for 1 in 5 people in the United States. Medicaid and the Children's Health Insurance Program, or CHIP, cover almost half of all children in the U.S. and guarantee children comprehensive coverage for all medically necessary services. School-age children, in fact, comprise nearly 1/3 of all Medicaid enrollees. A key feature of the Medicaid program is that it is a shared state and federal partnership, and the total cost of the program is split between federal Medicaid and states. This is a really important feature when considering the impact that cuts to Medicaid at the federal level would have on students, school communities, and state and local education budgets. And that's because Medicaid truly plays a unique and critical role in schools. And so if we move to the next slide, we'll see that for more than 30 years, Medicaid has supported the delivery of health services to students with disabilities by paying for the physical, mental, and behavioral health services necessary for equitable access to educational opportunities. All 50 states rely on Medicaid to cover the cost of these services. Medicaid also supports all students covered by Medicaid. Even if a student doesn't have a disability, Medicaid can pay for needed physical, mental, and behavioral health services. All of this has really cemented Medicaid's critical role for schools, and today Medicaid is the fourth largest federal funding stream for K through 12 schools, supporting $7.5 billion of school-based health services every year. And if we move ahead to really make Medicaid's role in schools even more salient, let's look at what schools are using these funds for. So earlier this year, Healthy Schools Campaign and other partners sent out a survey to over 1,400 school district leaders in all 50 states and DC, asking them how they currently use Medicaid and what would happen if Medicaid is cut. 86% of districts said they use Medicaid to fund the salaries of health professionals and specialized instructional support personnel, including school nurses, school psychologists, speech language pathologists, and occupational and physical therapists. Over half of respondents said they use Medicaid funds for mental and behavioral health services, and nearly half, 46%, said they use Medicaid funding for assistive technology and specialized equipment. So it really is very clear, Medicaid is a critical funding source for schools and for student health. And we know that a reduction in Medicaid funding will cause negative ripple effects on schools and their communities, many of which will be forced to increase taxes and reduce or eliminate programs and services, including non-Medicaid services, to overcome funding gaps. And so overall, school Medicaid funding benefits all students and is vital to local communities. And critically, strong school-based Medicaid programs rely on a strong Medicaid program. Cutting Medicaid is equivalent to cutting school district budgets. And so to provide more context of what is happening in Congress and where things currently stand for Medicaid, I am delighted to now welcome Orla Kennedy, who is a senior policy analyst for Community Catalyst. Thank you for being here, Orla.
Hello. Hi, Allison. Thank you so much. Can you hear me okay? Fantastic. Well, really happy to be here in this space with you all, and thank you so much to our partners at Healthy Schools Campaign for creating this important discussion today. So I'm going to build on what Allison just shared and talk a little bit more, as she said, about what is going on in Washington in terms of these Medicaid cuts. So we can go to the next slide. And the next one too. Perfect. And as Allison mentioned, I'm Orla Kennedy from Community Catalyst. I'm a senior policy analyst on our substance use disorders team. And Community Catalyst is a national nonprofit health advocacy organization that fights for a health system rooted in health equity and health justice. So we are very much part of the fight to defend Medicaid. So a couple of points, and these are somewhat repetitive of the great information that Allison just shared, but wanted to reiterate again that Medicaid really is a critical presence and resource in schools. And I'm sure this isn't new information to many of you here with us today. Almost 40 million children and youth are enrolled in Medicaid and CHIP. Medicaid covers health services for kids with individualized education plans, and as of 2014, can cover all Medicaid enrolled kids. And schools have to provide those IEP services, and many rely on the federal Medicaid dollars, like Allison explained, because it's a shared funding from the federal government and the state government. Many schools and districts rely on those federal Medicaid dollars to support what are already strained health and education budgets. So really, Medicaid plays a key role in actually paying for school health services. So for school nurses, speech therapists, school psychologists, essential substance use prevention and screening programs, mental health care, dental screenings, and even more school health services, and providers. And all of it varies by state, but would encourage you to check out the link there. That's a resource, fantastic resource from Healthy Schools Campaign folks that will give you a snapshot if you're curious to see, well, what's covered in my state? What can Medicaid pay for in terms of school health? And that will help paint a picture of really how integral it is. We can go to the next slide. And so now, if you hear folks talk about the one big beautiful bill, the budget reconciliation bill, the Medicaid cuts bill, that's all this same, we're talking about the same piece of legislation that is being rushed through Congress, and all of it really means that Medicaid is under attack. And so it is getting a lot of coverage in mainstream news outlets talking about the alarming cuts to Medicaid and what it could actually mean. And this has been well, we're in for the fight for June. So I'll just keep picking it up from there. So as of last week, this bill did pass the House just by a very small, by one vote. All Democrats voted no against it, and then two Republicans, Rep. Davidson and Rep. Massey from Ohio and Kentucky, sided with the Democrats. But really, this was an unprecedented, these cuts are unprecedented. They are the largest proposed cuts in the program's history, and it has now gone out of the House subcommittees, has now passed the House floor vote, and is now with the Senate. So this is real, it's happening. You might be hearing about it in your everyday news outlets as well. But so that's the status. So we'll go to the next slide. So here's what's in the bill that passed the House. So this is what we're, in terms of what has already passed and what's now under review with the Senate. And it's a couple of things that all relate to Medicaid cuts. So the big things are that there are now mandatory work reporting requirements for people to be eligible to maintain their Medicaid coverage. And that start date for when those are required has been moved up to as soon as December 2026. And then also there's required eligibility redeterminations every 6 months. So all of that means paperwork, burden, administration, staff time, resources, money, all of that ultimately will lead to Medicaid cuts. It also explicitly reduces Medicaid funding, federal Medicaid funding for states that provide health coverage to undocumented immigrants, as well as other really harmful policies against immigrant health care. It also expands the discriminatory prohibition on gender-affirming care in all of Medicaid to all Medicaid beneficiaries, not just for kids under 18. It also penalizes states that have expanded Medicaid and disincentivizes states from expanding Medicaid moving forward by allowing higher payment rates in the non-expansion states. And again, there's some more policy wonkiness there as well in the weeds, but ultimately it's another way of reducing Medicaid support, federal Medicaid support. And then again, in terms of the marketplace, so even aside from Medicaid, but other broad healthcare cuts, it reverses current policy on some cost sharing reductions by reducing the amount of the tax credits that people could get to purchase marketplace coverage. So that's kind of a snapshot. There's tons of other stuff that's in there, but those are really the specific Medicaid and healthcare related attacks. We can go to the next slide to kind of talk more about what this actually means. And as I said, all of these provisions result in Medicaid cuts. So anytime you hear work requirements, eligibility redeterminations, anything like that, that's going to end up in people losing their coverage. And the expected result, and this is the figure that came from the Congressional Budget Office, is that 15 million people could lose their coverage because of these Medicaid cuts and the other attacks on the tax credits and the other cuts to healthcare. And so just big picture, that means more kids uninsured, more families uninsured. And now that we have the grounding for what an essential source Medicaid funds are for schools, that means there's a loss in all those federal Medicaid dollars. So that means higher costs for school districts, for hospitals, for local governments, and for families, and for really folks not getting the care they need. And of course, there's tons of coverage, there's tons of research too that really talks about the importance of health insurance being stability for the whole family. And so even if there's a parent, let's say they missed their paperwork deadline to prove that they've been working a certain number of hours, so then they lose that coverage. That has ripple effects for the whole family. And so that's kind of the context that we're in. And then really want to keep in mind for this discussion here too, and I think Allison did a great job teeing this up, is that how intertwined school Medicaid services and school access to Medicaid services, all of that relies on a strong Medicaid program. So all of these cuts to the underlying federal Medicaid program really have impacts for services in schools. Because as Allison said, Medicaid is jointly funded by the states and federal governments. So it's not just putting school Medicaid services at risk, it's also putting all state services at risk because as more costs are shifted back to the states, those strained state budgets are going to have to be cutting other programs to fill those gaps. And unfortunately, after healthcare, it's often education budgets that are also ripe for attack. And then just one other note on the timing, the version that passed the House and that is now with the Senate, as I mentioned, pushes up those mandatory work reporting requirements and eligibility redeterminations to a sooner date of December 2026. So very soon, which means that the real impact of the cuts on federal dollars impacting state budgets can be very soon. We can go to the next slide. And a couple notes on timing. So as I said, it passed the House on the 22nd last week. It's now with the Senate. The content, the specifics of kind of those bullet points of everything that I outlined that's in the House bill, it will likely change because as it's with the Senate, it has to follow parliamentarian review. And since it's a reconciliation bill, it means that all of the provisions have to be budget related and it has to line up. There's a link there to an article in Punchbowl News that kind of goes through more of the Capitol Hill insider background info on kind of what the expected changes might be in the Senate. But the things to keep in mind are that the bill can pass with a simple majority, which means we need 3 Republicans to oppose. So it's not it's manageable. And then the Senate version then has to go back to the House. And in terms of for the final vote, and in terms of this expedited timeline, I mean, everything is kind of changing day by day, but the goal, Congress's goal supposedly, is to try to keep this rushed through to get a vote on the final package before they all go home to their districts for the July 4th recess. So June, these next couple of weeks coming up, are a critical window to stop the bill from moving forward, either stopping it moving forward entirely or delay. Anything that delays the bill and delays the process is another day that people get to keep their health coverage and that school Medicaid is more secure and more stable. So we'll go on to the next slide. So yes, while we're focusing on the Senate, these are the specific senators that have been identified as targets among our advocacy coalition partners, as well as kind of from information from our lobbyists. If folks have specific questions about why somebody is or is not a target, please let me know and I can pull up that information. But typically it has to do with who's up for reelection, might be in a vulnerable district, who can be held accountable, who has already expressed concerns or support for Medicaid, concerns about Medicaid cuts or support for Medicaid in the past, who lives in really rural districts, so would be feeling these cuts especially, all of that. So that's kind of the compilation. We can do the next slide there. And so now in terms of what we can do and what actions we can take, and as Allison said, we're going to be finishing up the call with some quick calls to action. But really the main message right now for the next couple of weeks is if you work with schools, if you work in schools, if you have kids in schools, you care about schools, it's really time to tell Congress we have to oppose these Medicaid cuts so that all children can learn and thrive. And so one of the ways to do that is calling your senators directly. And so there's a call script that's linked there that I'm sure will be sent out following the call. But yeah, it's a time to share your stories, share your experiences, make the case for why Medicaid is so important to you, your family, your students, your colleagues. So that's all there. And then there's another link to a whole ton of resources that we have at Community Catalyst that's sort of a landing page for Medicaid defense messaging. And if you want to learn more about what these work requirements are, there's information on that. If you want to learn more about what this would mean in other settings in rural areas or for people with substance use disorders, especially, that's all of that information is there. And then there's also a direct link that you can record a video of yourself sharing your story about how Medicaid is important to you or has helped you. And yeah, I think that about wraps it up. I guess I will just add that Community Catalyst, myself and my colleagues we're on deck to help and support anyone who's on the call who wants to be more plugged in to this Medicaid defense work over the next couple of weeks. And if you want to connect with other state campaigns and other health advocates who are in your area, please reach out and let me know, and we can work to put you in touch with any of the folks that we're working with so that you can be up to date on any town halls or events or press events or anything like that. But yeah, that's the main message. And Medicaid, it is getting a lot of attention in news outlets as this is why Medicaid is bad, about this is why the cuts to Medicaid are so bad. But I think there's a lot more that can be spelled out about, in particular, what this would do to schools and school systems and school districts and for teachers in the classroom and for kids in the classroom. So it's all an opportunity to make that part of the case for why we have to defend Medicaid. But yeah, I'll pause there and I'll turn it back to Jesse.
Thank you, Orla. Thanks so much for that overview, for everything you've shared, and really highlighting and laying out what's at stake right now. There is so much on the line, but as you talked about, there's also just some incredible advocacy happening right now across all levels of government to defend and protect Medicaid, as well as protecting students and schools. So I'm really excited now to introduce a panel of experts that are joining us today to share how they're working to defend Medicaid cuts and move the school Medicaid program forward in their states. So we'll share, they'll be sharing a little bit about their advocacy, how they're navigating this moment. They'll each be sharing individually, and then we'll have all of our speakers come together for a panel discussion to talk strategy and answer any questions you all might have. And again, my name is Jessie Mandel. I'm with Healthy Schools Campaign, but I'm so excited. I forgot to introduce myself because I'm so excited for this panel. So let me first introduce our speaker, our first speaker, who will be sharing the perspective from Utah. And then I'll introduce each of our speakers as they come on. So first, let me introduce Thais Del Rio. She's the policy analyst with Voices for Utah Children. Thais, thanks so much for being here and sharing your perspective.
Thank you so much, Jesse, for the invitation. Hi, everyone. So excited, so honored and humbled to be in this virtual call with all of you and my fellow panelists. So yes, my name is Thais Del Rio. My pronouns are she, her, ella. I'm a policy analyst at Voices for Utah Children, as Jesse mentioned. We're a statewide multi-issue advocacy organization, and we advocate for Utah kiddos and their families on an array of different social issue areas, children's health being one of them. And I want to apologize in advance if I have to go off and on mute. I've been recovering from a cold, so I'm on the lingering cough phase right now. So apologies in advance there. But I have the honor of leading out on our Medicaid and children's health policy work for the last 2 years. And really at Voices, we approach advocacy through a deep centered, community-centered lens and data lens to help inform our policy work and our advocacy work. And just wanted to talk briefly about two of our efforts that we've been working on when it comes to Medicaid these last couple of years, and then recently amidst the federal budget conversation. So one of the key ways, excuse me, we organize Our Medicaid and CHIP advocacy is through our 100% Kids Coverage Coalition. We launched this coalition back in 2018, so before I was here. And it really with a simple but powerful belief that every child deserves to have a happy and healthy life, to be able to grow and have, multiple opportunities. And so we brought together the team at that time, which Jessie was a part of. I'd be remiss if I didn't shout her out with all the great work that she's done at Voices. Um, they brought together community organizations and health systems and advocates across Utah to fight for a vision where every child in our state has access to health coverage and care. Utah has consistently had a pretty low rate of uninsured kids. Currently, we have 66,000 kiddos who are uninsured. And we also have a pretty low participation rate as well of around 80%. So we know more kids are eligible for these programs. And so with this coalition, we've really honed down on 5 different pillars to meet our goal of ensuring that all kids are covered. First goal is ensuring that all kids can get coverage regardless of their immigration status, making coverage continuous all year long, which began last year, which is very exciting for kids in our Medicaid program. And then connecting families through outreach and navigation, protecting parent coverage. We know that when parents have access to coverage, when parents are healthy, so their kids are also more likely to be healthier. And then, of course, strengthening and protecting Medicaid and CHIP is our last pillar that we actually added last year when we, after our legislative session, when we started getting more Medicaid threats in our legislation. So really, thanks to this coalition and the leadership of so many folks, we've been able to help reach many of these goals and our pillars, including covering all kids. Again, which I'd be remiss if I didn't shout out my colleague Syriac and Jesse at the time, who was the deputy director, who really spearheaded this campaign to ensure that all kids, regardless of where they're born, have access to coverage. And it's excuse me, unfortunate now to see the provisions in the federal bill attack and punish states who are using their own state funds and their own legislative abilities, right, to attack programs like these. But I'm so proud of this program, State CHIP. It's now in its second year, and it's helped 2,000 immigrant kids in Utah get the care that they need when they need. And we've worked with amazing community partners on the ground who are enrolling families, who are talking to families who have been able to go to the doctor for the very first time. Kiddos have been able to get their glasses, visit the dentist, get their well child visits, right? And there's one story that really sticks with me about a family who came to Utah from Mexico, and they've been in Utah for over a decade. And their son was born nonverbal and had an undiagnosed condition, and they could not get the care that they needed because they didn't have insurance. And so once they were able to enroll in State CHIP, they were able to finally get a diagnosis. They were able to receive consistent care rather than going to the emergency rooms, right, which offered no long-term care solutions. So we know that programs like these work. We know that when kids have coverage, they can succeed, they are healthier, and it brings a peace of mind and hope and stability for families all over the US. And now, of course, with the ongoing threats to Medicaid and CHIP at the federal level, we are bringing that same collective power in creating a new coalition. We just launched a new coalition with a couple of other health advocates and organizations in our state. It's called Protect Medicaid Utah Coalition. And we are fighting back against these harmful federal proposals that, as we've learned, will gut Medicaid and cut services to students, to families, to immigrants, people with disabilities, etc. And so with this coalition, we've been excuse me, doing a lot of efforts to engage the community, to have meetings and discussions with our congressional delegations to share the importance of Medicaid and why Medicaid matters, and how these cuts will hurt not just us as individuals, but our state as a whole, right? Really ensuring that they know that these cuts are just a shift to, will just shift to states, and states will have to take care of that financial burden, but really uplifting and centering the voices of constituents who will be impacted by these cuts, and making it clear that we need to be loud and unapologetic, right, about what these massive cuts will mean to Medicaid and for all of us. And so we've been working hard with other health advocates in Utah to make sure that our voices are being heard. And I think this is really a moment where partnership really matters. And I'm really grateful to be working across sectors and with all of you to help protect Medicaid and CHIP. So thank you, Jesse, for the opportunity. I'll turn it back over to you.
Thank you so much, Thais, and for all of your work and the advocacy you're doing right now. And excited to talk with you more. I'm sure there'll be questions that we'll have during the panel discussion. But first, I'm going to now introduce our next speaker, Jennifer Thibault, the Senior Director of Strategic Programs with the Missouri School Boards Association, to share about the perspective of the Medicaid fight and its impact in schools and your work in Missouri. So thanks so much, Jennifer, for being here.
Thanks, Jesse, and pleased to be here, and excuse me, and happy to share what hopefully I can contribute something today to this webinar. As Jesse said, I'm with the Missouri School Board Association, and the School Board Association has a long history in Missouri of advocating for Medicaid in schools. So in 2008, after conversations with the Medicaid division in Missouri, which is called the MoHealthNet division, we actually stood up the Medicaid consortium. So it's a part of our nonprofit, the School Board Association, and we actually provide billing, provider enrollment services on behalf of school districts. So we cover support about 90% of the students in the state. So districts can choose whether or not to participate in school-based services in Missouri. If they do participate, they get 100% of their federal share back. That's always been the case. They can choose to participate with the School Board Association in our consortium, or they can choose to participate with another vendor. So we aren't necessarily exclusive. But I think, and in Missouri, just to give you a little background, right now, school districts are able to bill for SDAC. They're able to bill for direct services for IEP. And we just expanded this past fall billing for behavioral health services for Medicaid kids who are not, who don't have an IEP. I think the challenge there has been in Missouri, when you move outside of direct services related to IEPs, you have to bill the managed care plans. So we've moved from working fee for service and billing with MoHealthNet, the Medicaid agency in Missouri, to billing with 3 different managed care plans. So, and right now, our advocacy has been around how do we continue to increase those schools who are participating, whether they're participating in our program or participating in another program. Especially now, the financial stakes are high. I know in every state, but in Missouri, the schools did receive full funding, but that wasn't at the recommendation of the governor. The General Assembly finally made that decision. So financially, we've been working with schools to let them know like it makes sense to participate and take advantage of those Medicaid funding, that funding that's available today. We're also working on what does an expansion of direct services look like beyond behavioral health, and that becomes a challenge when honestly you're not just working with one insurance company, the Medicaid agency. You're now working with 4 insurance companies, because we have 3 different managed care plans in Missouri, and all 3 managed care plans cover the entire state. So when the discussion around the Medicaid cuts started to be front and center in January, February, I had some colleagues come to me and say, like, what do we do? Like, should we back off? Like, should we stop talking about school-based services? Like, should we move ahead with advocating for adding additional services? And my response was, we keep on moving until someone tells us that we can't do something. So even in this climate, while we've been working with schools around how to advocate to stop Medicaid from being cut. We've also been working with schools around what more could we do in the Medicaid space right now as it relates to supporting students in schools. So the way that we've been doing that is it's really more grassroots. So I think you have to understand what state you live in and how to really kind of navigate and how you can how can you be relevant and continue to be relevant even after I'll call this fight is over. And so I think that that's why we've been working with our district to try to empower them around how do they tell their stories, how do they share what's happening and what it means locally to them. In Missouri, we have over 500 school districts. And so it matters, I think, at a local level when we're empowering those districts to engage with not just the Congress members that come from Missouri, but also those Missouri legislators, because they can be impactful on lobbying even at a congressional level to help support what decisions are made. So that's really how we've been, I would say, trying to be supportive of combating Medicaid cuts. We're also members of a number of coalitions. So there's a Missouri Budget Project, Washington University, the Missouri Foundation for Health. So there's a number of folks that have gotten together and had formed a coalition just to make sure that we're all talking the same talk, that we're aware of what each other are doing, and that we really have a combined force when we're advocating for Medicaid and Medicaid for all individuals. I think the other thing that I've started to really think about, and we've spent actually quite a bit of time talking about it today, is around eligibility. And even though eligibility in this bill might not necessarily directly impact kiddos, it does, because our experience is, and I think everyone would agree, that when parents aren't eligible for Medicaid, or they know that they can no longer be eligible for Medicaid or won't apply, that absolutely impacts benefits for kiddos, and that's, that impacts kids being able to receive services, but it also impacts the ability for schools to bill for those services and to get financial support that can hopefully then be reinvested into providing services to schools. So thank you, Jesse, for the opportunity. I appreciate it.
Thank you so much, Catherine. Yeah, for everything you highlighted. There's a lot at stake, and so thanks for sharing your work and also how you're working on both fronts around strengthening the program at the same time that you're protecting Medicaid. So I'm now excited to have our final, last but not least, speaker from Ohio. Catherine Poe is the budget and health researcher with Policy Matters Ohio, and we'll talk a little about the work happening there. So thanks so much, Catherine, for joining us.
Hello. Thank you so much for having me. It's so lovely to see you all. I am also recovering from a cold, so it is just that time of year. So my voice is very scratchy. I deeply apologize. So just to talk a little bit about Policy Matters Ohio, we are an independent nonprofit think tank, and we often call ourselves the people's think tank because of the amount of emphasis that we place on being in community with organizers who are on the ground, who are really informing our decisions. Right now in Ohio, we are working on a state budget, and that is very deeply impacting the way that we are talking about these federal cuts. So our budget process has actually mirrored what's going on at the federal level. And June is going to be a very important month for us, not only in the state budget, but also against defending federal cuts. And so my role, especially as the budget person on staff, is to really make sure that our state lawmakers are thinking about what's happening at the federal level. It is very easy in a budget season to be very head down and try to be really focused on the budget and what's happening in your state, and really easy to forget what's happening in DC. and feel like it's coming later. And so a lot of our work has been trying to connect the fact that what we write in our state budget right now could be very influenced by these federal cuts and possibly lead to big loopholes. It could lead to big billion-dollar essentially gaps in funding where the state thought that we were getting money that we're now not. And so this has been a really big part of considering our strategy on Medicaid. I think it's really easy to think about Medicaid as its own siloed individual program. But as this points out, healthy schools and Medicaid are very closely associated with education. They're associated with kiddos' abilities to get healthy foods. And so part of our strategy has really been being creative about the way that we talk about Medicaid and where we're talking about it, rather than just talking about it in a healthcare kind of sphere. We're also bringing it into conversations with the teachers unions in Ohio. We just recently held a special education town hall where we worked with teachers unions and education advocates to talk about not only the state funding cuts that we are unfortunately experiencing to K through 12 education, but also incorporating the kind of double whammy of cuts that could be happening through a reduction in our Medicaid in schools program. And I think it's really important to highlight that a lot of programs, not just Medicaid or schools, will be getting this kind of double whammy hit from a federal reduction as well as a state reduction at the same time. So it's not just state dollars going away or just federal dollars. They're kind of happening in combination. And so we're really trying to build coalitions that are more holistic and bring maybe parents that weren't aware of how important Medicaid was for their kiddos in on that conversation too. So we recently just held that special ed town hall. It was really well attended. And now we are actually looking at doing one again next Tuesday, which is really exciting. This one will be focused more on Medicaid broadly, but we are also inviting our local food banks to come talk about how that will impact SNAP access. We're inviting the teachers unions to come talk about how that will impact their kiddos again. And so we're really trying to build this like holistic coalition of folks that all care about this topic because we're all on the same team in a state budget. It really takes all hands on deck. And so another thing that I often try to talk about with lawmakers specifically is how with Medicaid, it's really easy to look at the whole pie and say, well, this will just impact adults, or this will just impact older adults, or this will just impact working adults. That's not true. Shrinking the pie impacts everyone. This is not some program where cutting off resources to one will not impact the other. It will shrink and harm all people on Medicaid. It's not just the people that we feel like deserve it. We are also impacting kids and families and people that are reliant on this in order to feed themselves and clothe themselves and go to work every single day. Other projects that we're kind of working on in relation to this, so we're working a lot with our organizing partners to do things like work with churches. So we have a really amazing organizing partner in the Amos Project, which has done a lot of work to organize Black-led congregations in Ohio. We're also working really closely with the Children's Defense Fund, who also has a faith coalition of parents that are really dedicated to talking about their faith-driven reasons for wanting these programs to stay intact. And so we're trying to think about like unique coalition partners too, and folks that are really on the ground that can get this out to communities. I think the last one that we've recently started doing is when we looked at social media, we kind of decided to change the platform that we were doing. So we've actually been doing a lot of work on Reddit recently. And if you're not familiar with Reddit, it's a very like Discord server based online platform. But the thing that Redditors do really well is they read and they respond to long comments. And that has been really useful in helping us generate public comments. So during the Medicaid work waiver, we put out a call on Reddit to several of the like small cities, Akron, Canton, Reddits, and people submitted, I think, over 400 different public comments based on those Reddit posts. And so we've been trying to get really creative about where we go for stories and how we do outreach. Reddit was a totally new platform for us, but it's been a really great way to generate comments. So this moment has actually changed our social media strategy as well. So thank you so much for including me in this panel. And thank you to the other presenters. It's been lovely listening to you all.
Thanks so much, Catherine, for that. And yeah, that was incredibly helpful, and just appreciate hearing about the broad coalition that you're building and the new platforms that you're engaging people in. So I think that's terrific. So now I'm excited to bring all of our panelists back, all of our speakers back. And I think we have time just for a few questions, but did want to make sure we had time for questions to all of you. And if there are any questions from those of you listening and from the audience, please feel free to drop those in the chat too, or put those in the Q&A, and we can take those as well now. But I think just to kick things off, a question for all of you. You're all pretty seasoned advocates, or familiar with this kind of the ins and outs of how things work. But I'm wondering, there was a lot of folks on the call that are very familiar with the Medicaid in Schools program. Maybe they work directly in schools, directly with students. How do you jump in? How if people are new to advocacy, understand the connections and the intersections between Medicaid and education, but how do you kind of start to advocate? How do you plug in? So just curious what you'd all say from your perspectives for those that might have a lot of experience with this work but aren't quite sure where to plug in or jump in this moment. So whoever wants to jump in first. This is always kind of that awkward moment in panels, but if someone has a first thought, feel free to jump in.
I can go. So I first started off in advocacy because I was a patient advocate as a young person. So I started talking about my own patient experience. And I remember when I first started doing any advocacy work at all, the best piece of advice that I ever got was to just start doing it. And I know that that sounds like really like not a very helpful answer. But the first thing that I ever did that got me started on my journey was just starting to pick up the phone, right? Starting with those very low lift action items where you're picking up the phone, you're calling consistently. And then maybe you're standing in the hallway waiting to pick your kid up from school, and you start talking to other parents, you start talking to teachers. And then you start looking online and finding organizations that have action items and starting to volunteer with them. It is like a step ladder. You don't have to pick off everything all at once. You also don't have to fight the whole system all at once. The best thing that you can do is pick a topic that you really care about, where you feel like this is where you want to pick your energy, and like put your energy in one strong place. And over a period of time, you will start to be able to build toward that goal. There are lots of tiny topics that need a lot of love. I think that this is one of them. And so staying focused on a goal, staying intentional about what you want, and where you want your advocacy to go can kind of help you get started rather than feeling like you have to take on the whole system or you have to pick up the phone every time. Just take off little bites, just start doing that and get into the habit of doing that. And you will like well be on your way to like doing the thing. And so you just have to kind of like start doing it.
Well, and I'll jump in. I would suggest, sorry, I would suggest like looking for opportunities to connect. So even though like I spent 28 plus years in Missouri's Department of Social Services, worked in the Medicaid, like was the Medicaid director for a couple of stints, and worked in budget. And so I know Department of Social Services, I know Medicaid, but I didn't know schools. I've never worked in a school. So I started this job in November. And so I had to start to understand how to make those connections and to understand how schools thought about Medicaid, because I knew how I thought about it from my head, but I didn't know, I didn't feel like I could advocate for schools and school-based Medicaid until I understood how schools thought about that. And so I, tried to take opportunities to, what meetings do different coalitions have? Like, how do you engage in my mind, it was more around those kind of school focused, whether it be, your special education, whether it be your superintendents, like those other groups, and how did they think about that, about school-based services, but also just to create those relationships and to start make those connections so that, a lot of my work is done right in the schools and advocacy in schools. So how to create those relationships that I've never had, even though I have experience in Medicaid. So just coming maybe from a different standpoint. So.
I love all those thoughts. For me, I started in the advocacy and community organizing space when I was in high school, working a lot on immigration reform. And I remember just feeling so intimidated by advocacy. But I learned throughout these years that you don't have to do it alone, right? And you can start small. Start with your strengths and what you know and your lived experiences, right? If you're a parent or a caregiver, talk to other parents or caregivers at your school. If you work in a school, you are already on the front lines, right? Your observations, your experiences are advocacy. So sharing your story with a community group, writing a letter to the editor, or having a conversation with your local school board member. I think these are all very meaningful forms of advocacy, and there's not one right way, right, to advocate. Also considering joining community coalitions or advocacy groups and organizations in your community who have that capacity, right, that can provide some structure and support. A lot of organizations offer templates or legislative trainings and guidance to help new advocates get started. And I think what's really important and something that I've learned is that you don't need to speak in policy jargon, right? You don't have to have the perfect script. Your lived experiences really are more than enough. And advocacy really is that muscle that strengthens over time, especially when it's practiced, I think, with community. And I think from my experiences, the most powerful movements that I've seen that I have been a part of are really fueled by that collective courage. But also, advocacy can be hard on the heart and on the mind, right? And so burnout is so real, and it is okay to take a step back when you need. I've had many of those moments this year, right? And it's okay to take a step back because your community will be there to support. One of my favorite quotes from Angela Davis, what's helped me tremendously get through some of these times that we're living in right now. She says, it is in collectivities where we find reservoirs of hope and optimism. And it's through that collective work across schools, across families, across communities that we can really work together to protect Medicaid and advance a future where people can continue to receive the care and the services that they need to thrive.
I really don't have much to add. I love yeah, everything each of you said resonates with me. In particular, Catherine, kind of the push to just start by doing something, that really resonates with me. And even the feeling of kind of calling your elected, if you've never picked up the phone and called your senator before, or your House rep, it does feel it feels I mean, the first time that I was doing it, it felt weird. I felt nervous. I was like, God, what if they ask me something that I don't know about? What if I don't have the data points to back, And it's just sort of you can show up however feels right for you, and it doesn't have to be going from zero to then providing written testimony at a hearing. I think it's one of those things that the more you just start chatting, the more comfortable it will feel. And lean on the call scripts and the templates that are available. And if it feels unnatural, that's that's okay. Get the message out and it will start to feel more natural. And then also too, I'm mindful that depending on each of your professional affiliations, there might be restrictions or feel like there are restrictions on kind of how and what spaces you can be speaking up in. So, I mean, I'm not an expert in all of that, but my sense in communicating with my peers who are government employees that there's nothing stopping you from speaking up as yourself. And that's something to remember. And also that the advocacy can take all kinds of different shapes and forms. One example, I was talking with my parents, and I live in Massachusetts. They're in their 70s, and they're following the news, and they had no idea about the importance of Medicaid and school services. And I wasn't thinking about that as like an advocacy outreach opportunity, but everything can be an opportunity to kind of share and bring more folks into the conversation and into the fight. So it doesn't even always have to be your senators. It can be your neighbors, your colleagues, your friends, your family members. Yeah. And if you have
Thank you.
specific questions or want specific ideas and specific guidance on how to kind of connect with folks, please reach out to me at Community Catalyst and we can help provide that support.
Thank you all so much. Actually, Orla, that's the perfect segue for the final resources that I'm going to share. And appreciate everybody for dropping questions and comments and your thoughts on what you're doing in the chat too. But in our final minutes, as we wrap up, I actually want to share some resources that I think get at this very point too. Call scripts, great toolkits that we have just assembled in this area. So thank you all so much for joining this panel, for sharing your thoughts and experiences. Really appreciate all of your work and the work ahead of us. But as we wrap up today, let me just quickly mention a few resources. First, it's a new resource, a new toolkit that we have that we're really excited about. This is a resource that we're calling an advocacy guide for people who care about children's health. So that's all us. That's you. That's everyone. It's really meant to be accessible no matter what your experience is when it comes to advocacy or your familiarity with the Medicaid in Schools program. It also includes a call script. Orla mentioned when you call, sometimes you can not quite be sure where this conversation is going or how to address questions that come up. Well, we have a call script that is designed just for that, that Community Catalyst developed with Healthy Schools campaign. So we'll be sharing that following the webinar, but this toolkit has a range of resources that we're really excited to share with you all. In addition, we have an action you can take right now. This is an action alert that you can send, just click the link, you can send a message to your members of Congress now and tell them to protect Medicaid in schools. We partnered with Community Catalyst on this. It's fast, it's easy, so you can do it right now. And then finally, as we close out today, we have a number of other resources that we'll be sharing with you all following this webinar, including the Action Alert and Advocacy Toolkit, but some other great resources from partner organizations. So finally, thank you all so much to everyone, to our incredible speakers, to our partners, Community Catalyst on this webinar. And thank you to all of you for taking this time to engage on this issue. I know many of you are coming and jumping in with a range of experiences. We really just appreciate all of you for your work, for your advocacy. So please do stay in touch with us as we all work together collectively to share our voices that a strong Medicaid program is essential to supporting a strong school Medicaid program, and that we urge Congress to reject cuts to Medicaid so all kids, all students, all schools can learn, all students can learn and be healthy and thrive. So thank you all so much for joining us today. Take care, and thank you all for your advocacy. We'll see you again soon.